Thanks for coming. Look, one of the drivers of the success of Australia's healthcare system is its blended nature. We have universal healthcare delivered through 700 public hospitals underpinned by Medicare principles, as well as a really strong primary care system. But from the introduction of Medibank by Gough Whitlam and certainly the introduction of Medicare by Bob Hawke, that has always been supported by a strong private hospital system, funded in large part by private health insurance payments paid by millions and millions of families. And that private hospital system is responsible for about 70% of all elective surgeries, about 1 in 4 births every country, and receives very significant taxpayer support, amounting to about $8 billion through the private health insurance rebate. All of these parts of our system are interconnected, and there's a very strong national interest in ensuring that every part of it, including the private hospitals component of the system, is functioning well. A few hours ago, the second largest owner of private hospitals in the country, Healthscope, entered receivership and administration. Healthscope owns 37 hospitals in every single state and territory, as well as having a contract to deliver the Northern Beaches Hospital in Sydney as well. About 650,000 Australians receive a procedure and care through a Healthscope hospital every single year, and Healthscope hospitals employ about 19,000 hard-working doctors, staff, allied health professionals and support staff. This decision to place the ownership of Healthscope into receivership is not unexpected. We've been meeting as the government with Healthscope now for some considerable time, as speculation about this decision has been really been spreading through the community, and made very clear our expectations that the interests of patients and hard-working staff will be the highest priority through this process once it eventuated. I want to be clear that I expect to see an orderly sale process eventuate from this decision to a new owner, with no impact on patients and no impact on hard-working staff. My department over recent hours has already met with the receivers and made that exact same point to them. And we'll be engaging closely through the receivership and administration process to protect the interests of staff and patients going forward. I say that I'm being reassured by the Healthscope statement that's been released over the last hour or so that makes it clear that hospitals will continue to operate as normal. And I had a conversation over the last half an hour with the CEO, Tino, Laspina, and I sought an assurance from him that the thousands of Australians who right now have a birth planned or a knee reconstruction booked at a Healthscope hospital can be confident that that procedure will go ahead as planned and as booked. And I received that assurance from the Healthscope CEO, and I have to say I will be holding the company and the receivers and administrators to that commitment given to me and given to Australian patients and staff. Happy to take questions.
Does this have the potential